Hello, everyone. It's Dr. David. Today, we're going to do a question and answer regarding what are the things that you as a nurse can do after finishing nursing school. There's so many options. So, we're going to wait for some people to join us. I see there's a few individuals here. Can you put some questions in the comment box? I'm not sure who's here with us. And you're going to see me looking at my phone as well as have a notepad because I've been gathering questions that I've been receiving from students throughout the week via email or on Facebook. So if you see me looking at my phone, that's what I'm doing. I'm trying to make sure that I get all the questions that I can. I'm not sure who's here from Facebook, but I know that I did receive some questions. So let me see. Can some of you that are on right now put some questions in the comment box or introduce yourselves? Because I don't know who's here. It's not showing me your names. And you can ask me anything from an advanced degree, if you have an interest in nurse education. Do you want to be a nurse educator? Do you want to get a doctorate? Do you want to get a master's? Like what is it that you are trying to achieve after nursing school? I always tell students one thing. After nursing school, the number one thing that you need to worry about is actually getting experience. You need to work as a nurse, as a registered nurse, or if it's an LPN, if you want to work as an LPN, and then eventually get your RN, which I strongly recommend because you will expand all of your options. You'll be able to have more to choose from. But I see that a lot of students are so quick to go from nursing school into advanced degrees when you don't have that experience to back it up. I'll give you an example that I give a lot of my students. If when you're choosing a doctor or a nurse practitioner to visit, do you want the one that has been treating patients for a while, or do you want the one that just got out of school to start treating you and does not have that experience, does not have that background? So that is the same thing that patients think when they are choosing who to go see. If they have a choice between a nurse practitioner and two nurse practitioners, and one has been in the field for 4 years and the other one just got out of school because she had her BSN, went straight to a master's degree program and got her NP certification, they're going to choose the one with experience. So I always tell students, stop rushing to try to get into these advanced positions and these advanced degrees like an NP or PA, and focus on learning your patient, gathering the information that you need, learning how to treat your patient, how to take care of them. I mean, there's so much that goes on with a patient. You can have a code, you can have a rapid response. There's a lot of things that you need to learn before you go ahead and say, okay, well, now I'm going to become a nurse practitioner where I'm actually going to be taking care of patients. I'm actually going to be prescribing medications. And then great. No, because you don't have that background. So I always stress to students, you need to, hi, Super Nurse Nightingale. You need to focus more on learning how to be a nurse before you jump ship and say, okay, now I want to be a nurse practitioner. Okay, because that's, there's steps for a reason. And I do know that there are so many programs out there that are offering those things, that you can go from a BSN to an MSN or MSN to a DNP, nurse practitioner. And that's great that they have all these choices, but you also have to think about who you're caring for. Put yourself in that patient's shoes and say, do I want a nurse that has never seen patients in her life actually being the one that's prescribing things for me or ordering tests for me as my NP? So that's one of the biggest questions that I get from a lot of the students. Like, what is there after nursing school that I can do? And I said, you can do a lot of stuff. You can work in a telemetry unit, like a med-surg unit, in order for you to get that experience in those rapid response, the codes, trach care, wound care, actual time management when you're taking care of 6 patients if you work in a med-surg environment. Now, if you work in step down, you're going to get a little less. You probably get between 4 or 5 patients, and ICU is more focused, so you may get 2 to 3 depending. Hi, baby girl 95 and Rizaline. Hopefully I said that right. So there's a lot of things that you can focus on right after nursing school. Now, once you get that experience in, now you are able to say, okay, I feel comfortable. I learned how to speak with patients. Hi, Kieran. Learned how to speak with patients, communicate, feel comfortable, because a lot of students, even in this environment that we are now with COVID-19, where we're doing virtual learning, I've been teaching virtual clinical for the last few months. And it's been a totally different experience. And you're trying to get that real life scenario into this virtual environment. And sometimes it can be difficult, especially because students feel so intimidated when dealing with actual patients one on one. It's totally different when you are in a simulation environment, or when you have like those SPs where they act like they are patients. But when you're with a patient face to face, they start to stutter, they get super nervous, they don't know how to communicate. So all those things are crucial to understand in those first couple of years out of nursing school before you go and rush into trying to get an advanced degree. That is the one thing that I always tell my students, because nowadays everybody wants to get, like more and more and more in order for them to do more, but you have to kind of go back to the basics. Okay. Super Nurse Nightingale says, now they have NP programs for non-nurses. Yeah, that's super scary. I know that they are researching that, because they have to go through some legislations and stuff like that. So I don't know if that's going to really pan out. And know that when you finish these programs, definitely is super scary, very scary. When you finish these programs, wherever you work, they're going to know what program you did. So when you're coming from programs that are probably from non-nurses, that can be an obstacle because that's super new. But before we get into that, because that's definitely one of the points that I had in my little notebook here. So let's start from, let's say that you're an LPN, a licensed practicing nurse. Okay. I strongly recommend that you enroll in an RN program. There are more opportunities for you. A lot of hospitals and a lot of healthcare facilities, with the exceptions of nursing homes, want a RN. They are, for example, in one of the hospitals that I work for, they have removed all LPN positions and they actually made them like unit clerks, or sometimes they're being used in the ER environments like an ER tech. So it's very important that if you want to work in the hospital system, that you become an RN. And all you have to do is enroll. There's so many online programs. However, because you're coming from an LPN to an RN, there are clinicals that you have to do. So although I know that in the United States, there are some programs that offer the LPN to RN with the hybrid part of clinical, but there are not many. So for that, you would have to go to school in person to do your clinical. If you choose to go to an associate's level RN, I strongly suggest that you enroll in a BSN as soon as possible. There are a lot of hospitals as well that are trying to become magnet. Like I work for a magnet facility, and they gave the staff that were non non-BSN prepared a time frame for them to do their bachelor's degree. They want minimum of BSN prepared nurses in their facility, because that's one of the things that Magnet strives for, continuing education. So if you are in that realm where you are in the associates level, I strongly suggest that you enroll. There are so many programs that you can do online. I did see a program, Super Nurse Nightingale, that was about ASN to MSN. They're not common though, and honestly, I don't recommend that. If I haven't seen it around where I live, but I don't recommend going from an associate's to a master's. It's just too much that you're missing out. There's a reason why there's escalation. So for example, when you have an associate's versus a bachelor's in nursing, there's a lot of that research, that evidence-based practice behind that is learned, that's added on, which is what makes a difference. You have a lot of that research backing it up. Now, when you go from a BSN to a master's, those are advanced degrees. So at this point, you have been a nurse for a certain amount of years. I've seen nurses with a year enroll in advanced practice degrees or even sooner, but there's a lot of schools out there that will require at least 2 years of experience before you go ahead and do an advanced practice. For example, a nurse practitioner like adult, gerontology, maternity, like midwifery. So, although there are others that don't are not as strict with the timeframes, most are, because you are going to go through an interview process when you're going into these programs. They want to make sure that you are a safe practicing nurse in order to enter their program, and that when you do finish and you're out there, you're going to have to take that certification exam. So there are a lot of little requirements that you probably don't know of and that are probably not as evident when you're doing your research. But once you start talking to these individuals that are preparing you for those interviews and for those admission exams, they will say it. So if you are in an associate's program, I strongly recommend going to a bachelor's. Okay. Super Nurse Nightingale says, I've seen several. They include BSN Curriculum. Yeah, I haven't seen those yet, so I will research them, and probably I'll write some information under the description on certain programs if that's something that's interest of you to you. But I personally don't think it's like a good idea. I think that if you are in an associate's level, you should go to the BSN, try that, because you might not like. You have to really, if you're going to go into an advanced degree. Thank you. Yeah, you can send me some info. If you're going to go into an advanced degree, like a master's, I always tell my friends and students that ask me this, what is your goal? Like, what do you see yourself doing in the next 5 years? Okay. Because I am pro education. I mean, I didn't always start in nursing. I have a bachelor's in business. Then I got the bachelor's of science in nursing. Then I got a master's in nursing leadership and education. And then I went and I got my doctorate. So I'm super pro education. So if you are that, good. You always want to make sure that you're ahead of the game. However, I am so against rushing everything. So you need to really understand what your purpose is. So if you want to go into education, then great. Yes, go for a master's. But how would you know that if you're currently in an associate's level and you have to go to a BSN and then you have to go to MSN? It's kind of difficult for you to understand, like, what do you want to do at that point? Because every level has its own different experiences. Now, if you are if you already have a bachelor's degree in nursing and you're saying, you know what, I want an advanced degree, it could be because I want to go into education or I want to go and become an NP, fine, because now you're not like jumping so much. But if you're going from an associate's level to a master's, how do you know you're going to really want to continue that far if you don't experience what's in between? I don't know if I'm making sense. Do you guys understand what I'm saying for those that are live? For those that want to get a master's, they're thinking of education. They're thinking of independent practice, because one of the things that you can get as a master's, you can go the PA route. Like, that's another big question I get. What is the difference between a nurse practitioner and a physician's assistant, which is a PA? Both require a master's, okay? It's an MSN requirement. But there is a little difference that makes it all worthwhile to pick one from the other. And I'm not biased, but I'm going to tell you differences, and you're going to understand why I kind of like more of the NP route. So a PA, a physician's assistant, is just like what the word says. It is a master's degree program. They have to do clinical hours just like the NP does. However, unfortunately, they cannot practice independently. So they are always going to be under the confines of a medical doctor. They will be in the same facility as the medical doctor. It's not like they can go to another, I don't know, town and go see patients on their own. No, they always have to kind of be under the physician they're collaborating with. Okay. So that's why the term that I'm going to say now is used when they're referring to PAs. I don't like the term, but that is what they use. So it's easier to understand. They're called like eternal residents for that, because they're always going to be under the umbrella of a physician at all times. Now, an NP is a little different. Oh, but before I go into that, another big difference is that the PA follows the medical model. So as registered nurses, we follow the holistic model. When you become an NP, you add that to the medicine. So you're now prescribing, you're seeing patients, and you are an independent provider. You don't have to be under the same roof as the collaborating physician that you are working with. Some have their own independent practices without a collaborating physician. It's per state, they have their laws. So, some states might say it's fine for you to run your own practice. You don't need an agreement. Some states, like in Pennsylvania, I believe, and in the state I live in New Jersey, you do need some type of collaborative agreement, but the physician does not have to be in the place. Like one common example is like your Walgreens, when they have those quick outpatient care, that's run by NPs. There's not a physician there. So that is a key difference between a nurse practitioner and a PA. A nurse practitioner can independently practice holistic medicine, but a PA cannot independently practice. They're both master's degree programs with clinical hours attached. And the amount of clinical hours depends if you want to become a family nurse practitioner, if you want to become an adult nurse practitioner, a geriatric nurse practitioner, pediatric. They each have their own individual hours. The one that has the most hours for all NPs is the family, because you have to cover the entire realm of that person's lifespan. So just to review the key differences. A PA follows the medical model. So they actually will go through a medical college to get their degree. They don't include much of the holistic part that the nurse has. So in the NP, they get the prescriptive rights, the independent practice, and they also incorporate that holistic model that as RNs we learn every day when we're in nursing school. So those are the key differences. I always say that the best PA job to have is like to work for a cosmetic surgeon, because they usually are helping out in the surgery. They're very involved in the practice. I have a good friend that she's a PA in orthopedic practice, and I've talked to her extensively about these differences, and it ultimately is that one is more medical and one is more holistic, but both are advanced practice degrees. And there are so many programs out there that are accelerated. I do know that. There's like the MSN DNP, which is a doctorate in nursing practice, accelerated. There's also the BSN to DNP, but you have to know what you want to do with that. Like I had it as a personal goal that I wanted to do my doctorate. Okay. I'm one of the people that do not like to be rushed into doing absolutely anything. So with all the new practices that are happening, there are more expectations of you. So I rather do things at my own pace. Super Nurse Nightingale says, for those programs that are ASN to MSN programs, you have to be sure that is what you want. Those credits don't transfer. Exactly. So that's why I mean, like sometimes when these programs come up that are so relatively new, because I have not heard of those. Okay. So when they're so new like that, you have to kind of be weary of, okay, are they accredited? Would they lose their accreditation in the future? Are they going to still be valid in a couple of years? Because I'm sure that a program like that's from an ASN to an MSN is going to not be 1 or 2 years. It's going to be a while. So it's very important for you to understand that it's best to kind of take it a little slow when you don't know what you're going to do with a certain degree in the future. I know that we all want more and more and more and more, but we also have to be smart and say, okay, what am I going to do with this when it's done? Right? Because if you don't have a plan in place, you can get 10 doctorates and do nothing about it. Like, okay, now I have 10 doctorates. What am I going to do with this? Right? So like for me, how I said for my doctoral, I wanted it as more of a personal goal. I wanted to have it so that I won't be expected to have anything else. And also one of the goals that I've always wanted to do is I wanted to be a online moderator. For example, if you are taking online classes, the teachers that you have, the professors, all are moderated by one person, and that person has to have a doctorate degree. So I always said I could see myself like at a beach somewhere in the sand and moderating these classes. That's like the best retirement job. So I always had that in my mind. But things changed. Now I have other goals that I want to do, because once you have a doctoral degree, it's like all the doors open. I see this as like a little door. Let me read this first. So Jessica says, good to know. Great. And then you mentioned magnet hospitals wanting a BSN. Do they typically hire ADN with an agreement to continue, or do they only hire those with a BSN? That's an excellent question. And then, okay, let me ask. Oh, now I have two Jessica. So let me answer Jessica R first. So she said, are they typically hiring associates level nurses with an agreement to continue, or they only hire those with BSN? So that's a good question, because it's been a debate for the last couple of years. There's a lot of hospitals that are going magnet that are only hiring BSN prepared nurses, because that's one of the things that they kind of strive for. Okay. Now, if they do have associates prepared nurses in the hospital, what they have been doing is they're not going to fire you, but they're going to give you a time frame. They're going to say, we're going to give you until 2021 to get your BSN. They also will increase the tuition reimbursement. That's something that has happened in the facility I work for. So they will give you a chance. Now, hiring you with an associate when they are requiring their staff to have a bachelor's, no. There are some hospitals that are still doing so, especially those that are affiliated with associate nursing programs. So like there's a hospital in my area that also has their own nursing school, and it's an associate's program. So how hypocritical would it be for them to say, oh, no, I'm not going to hire you because you have an associate's? That's their program. So they are hiring them. But a lot of other hospitals, and I know I don't want to break, oh, hey, Kim. I love Kim. Kim's like one of my besties. So I'm always on her for her to continue her education. And she knows, because we work in the same facility. So they give you a chance for you to get your BSN, but to hire you with an associate's, they're not. How I said, but there are some facilities that will. Okay, they still will, especially if they have that affiliation with an associate's level program. But unfortunately, if you do have an associate and you're working in a hospital that's changing their policies, they will give you a time frame. And if you don't comply by that time frame, then unfortunately, you would have to probably find another job. But what I've seen in the facility that Kim and I work is that they will get their bachelor's, a minimum. Now, you have our older nurses that are like, you know what, I'm not even going to waste my energy. And they probably will retire early. But I've seen some that would just go and enroll in an online BSN in order for them to continue working at the facility. And then the other Jessica says, are there any concerns of NP or PA being more pushed out in the near future? I hear NP being oversaturated or possibly dissolved. Is there truth? No, there is no truth to that. If you actually read on the like insurance policies, like medical insurance and stuff like that, they prefer to have patients actually see an NP. Because they have that holistic part to it. They're not quick to say, okay, let's go get an MRI, let's go prescribe you this. They're going to look at the least invasive things first. So there is no truth to that. There are so many programs that are being done right now and created in order to entice nursing to go into advanced degrees, so that NP, because there's so many primary care doctors that are retiring. There's not many individuals that are actually going into family medicine anymore. If you see a lot of people, and if there's research that has been done on this, that are going more into specialty fields as opposed to family practice. So that's been kind of being taken over by NPs. But remember, there are so many things you can do with a master's. If you have an advanced degree, it could be as an NP or, a master's of nursing education and leadership. You can become a nurse educator. You can teach clinical. You are able to teach others if that's something that is interest to you. I have received some emails about some students that are interested in doing that. Now, Would you want to be taught by someone that has no experience? Probably not, right? If you are a nursing student. So that's where the not rushing into doing it comes along that I've been talking about this whole entire time. You want to have some experience. Never leave the bedside when you start teaching if that's where you're going to be headed, because you always want to be up to date with evidence-based practice. So let me see. Super Nurse Nightingale says, in PA, they merged the hospital diploma programs with universities now. I love the hospital-based programs. Yes, so there are not many diploma programs. So for those of you that are live that don't know what a diploma program is, a diploma is not an associate's in nursing. A diploma is a diploma, and they're affiliated with a community college. And usually these students will get an associate's in applied science or something science related, but not in nursing. And the degree that they get is a diploma in nursing. Those programs have been phased out for a while now. Like I think that the last program that was phased out it's almost phased out. It's still in New Jersey. But those programs, since like it was in the 70s, like usually they would start it with nuns teaching it, and then slowly they've been getting out. So there's still a few left, but definitely a hospital system, with the exception of those that are affiliated with a diploma program, are not going to hire diploma prepared nurses. How I said, a lot of them, especially those going to magnet, want BSN prepared nurses at a minimum. Jessica says, yes, thank you. I am a holistic person and I want to keep my eyes on an NP, which is nurse practitioner, or informatics. I just have to get further in my nursing journey to clarify. And that's exactly what I've been saying. Like, how do you know if you have right now an associate level, what you want to do in 5 years? That's probably going to take for you to complete to, if you were to do those ASN to MSN programs, like you don't know. The way you know what you like is by actually working in the field and caring for people and interacting and networking. Like networking is just key. Informatics, I have a good friend that is doing her master's in informatics, and that is like the go-to right now for a lot of people because there are so many different programs that are being created with this EMRs, the electronic medical records, for example, Epic or Cerner or Sorian. There's a bunch of different ones. And nursing informatics is a crucial component of that. The majority of the team are nurses, because who are the ones that are mostly documenting? Who are the ones that are at the bedside with these patients at all times? We are, right? Yes, the physicians comes in and all that stuff, but we are the ones with the patient. We know what's going on with the patient. We're the ones documenting. We know what to document. We know what we need. So who is best to be part of those teams? Nurses. So you're going to see like 95% of the people that are in the nurse informatics, in the informatics team at a hospital, are nurses. So that is why they made a graduate degree program for informatics, because it is such a big thing to get in. And there's so many other things that you can do with that as well. Okay. Now it's different than if you were a nurse practitioner. Obviously, if you go into a master's degree program for informatics, is that you cannot go and prescribe and none of that. That's only if you are an NP, and depending on the specialty, and then you go and get your certification exam. And remember, there's also the prescriptive authority. So don't think that if you graduate from an NP program, a master's degree, nurse practitioner, you're going to just go and prescribe stuff. No, you need to get that authority. There's a test you have to take. Jessica says, do you think shadowing is helpful to figure out what you want to do? Definitely. When I teach clinical now in this virtual environment, I haven't, but normally when I am in the hospital setting, I love to rotate my students through different specialties. I'll send them to the cath lab, I'll send them to the rehab, I'll send them to endo, to same-day surgery, OR. I want them to get as much exposure as they can to different places. Now, once you're finished with school and you're an RN and you want to go shadow a nurse practitioner at a family practice or a gerontology nurse practitioner, just make the contact. That is why networking while you are working in the hospital, or wherever facility you are, where you end up working, is so important. You'll meet so many people. So if you do have an interest in those different fields, you just have to ask the question. You can even ask a primary care physician, like a family doctor, can I shadow you? Because if you are interested in family practice, that will be the place you would be working in. If you are interested in an adult nurse practitioner, I have so many friends that are adult NPs that work in the hospital setting, or they work in private practice, that would love to have students shadow. And there's actually on Facebook, I'm going to find it and then I'll link it to the description once I find it. Different groups that love to have mentees. So they want to mentor those people that are interested in becoming nurse practitioners. Cheyenne asks, will DNP become the requirement? So guess what? I had that question right here because yesterday I received that question several times through Facebook, Instagram, and messaging. Well, that became the topic of conversation back in 2015. So it was a big thing that, okay, by 2015, NPs, which again have a master's in nursing, needed to have their doctorates by 2015. Well, that didn't happen because, there was resistance met, and, it was like the notice wasn't, they didn't give them enough notice. I guess, I think they did, but some people say, oh no, 3 years is not enough. I have a life, I have kids, I have this, and that's fine. But then they did some research after the 2015 mark went, and they noticed that not many of them got the doctorate. And if they didn't let them practice, we're going to have this void in medicine where, okay, what's going to happen with all these patients that have been seeing these NPs? Are they not going to be NPs anymore? So they did some research, and they found that they don't really need a doctorate for them to practice their role. It doesn't have to be part of their scope of practice. Like, it's not going to affect the way they prescribe, the way they care for patients. It's going to give them additional research education, and you're going to create projects and write your dissertation and stuff like that. But that's not really going to change the way you care for your patient and treat your patient and prescribe things for your patient. So they've let go of that requirement. So no, so the DNP is not a requirement for you to become a nurse practitioner now. So let me see if I missed any other questions. So one other thing that I got emailed was, what do I need to do in order for me to be a nurse educator? So let me see. Kim Ecker says, do you think BSNs will be phased out eventually? Okay, so Kim is asking me this because I am on her to continue on to her master's. Okay, I'm always on her for that since I've met her. I believe that depending on where you're working, so anything can happen, right? They change from having a diploma to associates would be fine, and then BSN. Okay, I don't think they'll be phased out. Okay, because the BSN includes research, evidence-based practice. You're learning every single day new things, and you're researching, and you're doing your continuing education credits and reading journals and doing your mandatory educations and stuff. However, my thought on that is, if you can go for your master's, go for your master's. Because if they do phase it out, which I doubt, they will not be able to phase out a master's degree. Okay, because that anything above the master's is optional. Okay, especially if you're working at the bedside. All right. Now, can things happen if how the 2015 rule about NPs, and can they bring that back? Yes, they can bring that back because that's a different type of environment. Okay. But when you're working at the bedside, or if you're working in same-day surgery or surgical, wherever in the hospital with patients as a regular registered nurse, I don't think that the BSN will be phased out, but it doesn't hurt to go for a master's, because that for sure will never be phased out, because that is like above and beyond what you would need as a bedside nurse. Okay. Now, if you're going to roles like clinical outcomes manager, which are in charge of education of units and making sure things are done correctly, then yes, you should go to the master's level, because you should always know a little more than those that you are managing, right? That's how I think of it. For example, I teach clinical and I also work at the bedside. So I teach BSN students. So for me to teach a BSN student, I should know more than the BSN student, right? That's why there's a master's requirement, doctorally preferred, right? Now, if I wanted to teach master's level students, you need to have a degree above that. So I have the doctorate level already. So that is one of the things that motivated me to get my doctorate degree, because I didn't want to have limitations. If I wanted to teach one day a master's class or a BSN class, or be an online moderator, or mentor other doctorally prepared students, like they're in the process, I wanted to be able to do that without limitations. Lovely says, if MSN FNP goes back for her a DNP, is there another certification exam that has to be taken once completing the DNP program? No, there is not another certification exam. There is a dissertation. You do have, do you want me to talk about the differences between a PhD and a DNP? Jessica says, it may become the new minimum. What may become the new minimum, Jessica? And Kim Ecker says, can I teach online as a BSN? That's a really good question. Yes, you can, but you would have to teach a degree below you. So for example, if you are going to teach techs, like an LPN, or I'm not going to add associates to that, because that's kind of iffy depending on the state. Like I know some states require an MSN when you're teaching nursing students. However, if you have a BSN and you want to teach online or even in person, you can do it for LPN programs. You can do it for certified nursing assistant programs, medical assistant programs. So you can teach, but you are limited to what student population you can teach. No problem, lovely. Oh, a BSN. So Jessica, it may become the new normal to have a BSN. Yes, it is going to become a new normal to have a BSN. I see a lot of students enrolling in associates programs, and if I get to them before they make that last decision, I usually convince them to enroll into a BSN program. Some people don't agree with me doing that, but I know what's going to be best for them. Why waste the time if you then are going to have to go and do it, right? Now, the other thought process is, people have responsibilities. We all have to work. We all have bills to pay. So one of the things that depending on the individual that I'm talking to, that I say, well, if you're going to get hired with your associate's degree in this hospital, take advantage of the opportunity and then enroll in a BSN program and let them pay for it, because they're going to have tuition reimbursement, and usually it's pretty good, and they will cover you might have to put a little more, okay, but it will cover most. So do it that way. If they're going to hire you with an associate's, take advantage of it and then just enroll in an online BSN program and let them pay for it. That's my thought process on that. Jessica says, Nevada requires a master's to teach nursing today. Exactly. That's what I mean. So it's per state thing. I live in New Jersey. For me to teach BSN students, it's required to have a master's at a minimum. Okay. Now in Pennsylvania is a little different. In Pennsylvania, they don't require a MSN, a master's, but you have to be enrolled in a master's. Now, let me add something to that. I work for a school in Pennsylvania that they don't care what the requirement, that they say, MSN preferred, but it has to be enrolled. They want their instructors to have a minimum of MSN, because every school can put their own policies in place. Okay, but the state says that it's okay for them to teach as long as they're enrolled in an MSN, but the schools can alter it and say, no, my instructors, my clinical instructors have to have an MSN. And that happened. And a lot of people got let go. Okay. A lot of people got let go. So they had to finish the program, the MSN, or I don't know what they did, but that was a requirement. So every state is different. Every school can put their own mandates. But definitely, if I'm going to be teaching BSN prepared, like students that are going through the BSN program, I'm going to want to have something above and the experience. Okay. And this is a big point that I also drive to students when they're getting information from, different YouTube channels, different tutors. I call them tutors, because some people now, I opened this channel and if you were in my previous live, I talked about this. I opened this channel because I felt that at this point in my life, when I'm already, I'm doctorally prepared, I bring the experience to the table. I'm able to, teach you things, and in a way that's understandable and reliable. Everything that I teach is evidence-based. But I see so many like everybody wants to have now a channel teaching students. And I feel bad for the students because the students don't know any better, because they're just trying to get out of nursing school and finish and get the NCLEX and get out of there and start working. And they're buying this, they're buying that, and that. There's no need, but I want you to understand that that you need to get your information from reliable sources that have the experience and have the credentials. Credentials mean something. They're not just there to, they're like this one doesn't have my credentials on it. My other lab coat does. But it's important that you understand that there's a big difference between someone that's trying to teach you as a tutor and someone that's trying to teach you as an educator. A tutor and educator are two different things. Super Nurse Nightingale says, they have been saying NPs will need their DNP soon. I haven't heard that yet, okay? But I'll look into it. I haven't heard about it yet. Usually, if that's the case, they would be giving them like a 5-year time frame. But again, they did that research that says that having that wasn't really going to change all that. Kim says, I don't want to go on for MSN. What a headache. Let me tell you something about Kim. Kim texted me the other day and said to me, I'm going to put her on the spot. Should I go for my MSN or doctorate? And I said, what goals do you have to complete? Like, what do you want to do with your MSN and what do you want to do with your doctorate? Okay. So I forget what she answered. I think I'm still waiting for the response. So when you're trying to decide if you're going to do one or the other, like if you're going to say, okay, if I'm going to do a master's, should I continue for my doctorate? What are you going to do with this doctorate? Remember, I asked that in the beginning. So when you're getting things, what are you going to do with them? What are you thinking that you're going to accomplish with them? Because maybe it's not right now. Maybe you can do it in 10 years. Okay. You don't have to rush to do it now just because, oh my God, I just got to get the study done and whatever. Okay. So if you want to get the master's first because you want to teach, great. Maybe. Okay. So you just have to kind of know what you want to do. Melissa Julie says, thank you for your advice. The last time on your channel, I've been looking into WOMU for my BSN, and see, that's where I did my master's. That's where I did my doctorate. I mentioned it in my previous Q&A, and I'm not promoting anything. Okay, I'm not getting paid for anything. I have to just say that. Okay. I just truly do love Women's University. They're very adult friendly. They're very accommodating. Their classes are excellent. I learned a lot, but there's something that has to be said about the faculty. They are great. Dr. Seaback, Aaron Seaback, he has like credentials A through Z. If you look at my channel and you see my doctoral graduation, he's a really tall guy, and I even put on the description, Dr. Seaback, A through C credentials. He will probably take 5 lines, but they are so committed to your education and for you to succeed that is just amazing. So I did my master's in nursing education and leadership there, and I thought that was going to be it. And then I said, you know what, I need to do this for myself. And then I enrolled in their doctoral program, and it was just great. Even from beginning to the day of graduation, it was excellent. Melissa says, I plan on going further to the DNP. So Melissa, are you currently an RN? Are you, do you have a BSN? Oh, you said that you're looking for the BSN, but are you going to go for your MSN first, or are you going to do nurse practitioner? Like what do you think you may be doing? Erase this a little bit. Let me see. I'm going to look through the questions to make sure I didn't miss anybody. Kim says, I'm comfortable with Wilmington University. They are great. Yeah, Wilmington, excuse me. I have like a tickle in my throat. Like I've had that tickle in my throat for the last hour, and I knew it was going to come out. You go to WILMU, WILMU.edu, or Wilmington University.com, I believe, or is it .edu? I forget. And you'll see they have nurse practitioner routes. They have a bunch of different nursing programs. They even have one now if you have a PhD and you want to also get a DNP. So you know what I'm going to do? Let me talk real quick about the differences between a PhD and a DNP. Let me know if this is something that interests you, but I'm going to start. Okay, just tell me yes or no, whoever's on. So when you get I'm going to use, Lovely says yes. Okay. I'm going to use an example. So let's talk about the wheel. Let's say that we did not have a wheel made. We don't even know what a wheel is, right? So a PhD program, that person creates the wheel, right? Then they create the wheel. They kind of maybe test it out, maybe not too much. They have a little control group. They test to see something. But then the DNP program comes and takes the wheel and actually puts it to work. So now let's put it on a car to see if it actually works. We're going to test it. We're going to see how this intervention works for individuals, and voila, that is the difference. So a PhD program invents something, creates new knowledge, okay, new information. And then the DNP program takes that information and implements it somewhere to see if it actually works and how it works. Did it change practice? Did it help others? What data did you get from it? Then you write your dissertation. So that is the big key difference between the two. Now, some people might say, why should I choose a PhD, or why should I choose a DNP? Well, it just depends on your goal. Do you have a goal of becoming like an administrator for a university? Usually people that go for administrative positions like chair, president, VP of a or dean of a college, they are required to have a PhD. Okay. Do you want to use your doctorate in practice? Do you want to help in a hospital system? Do you want to create different interventional programs that will help improve patient outcomes? Then the DNP will be the route. So that's more practice based as opposed to research based. So remember, the PhD created the wheel, the DNP puts it into practice. Does that make sense? You can get both. Like my Dr. Sebak, who's the doctorate program at Wilmington University, research person, exactly. Research. He had a DNP, and he now has a PhD because he is in administration at a university. So that is something that is required for that. Lovely says, this was helpful, good to know. Great. And that's, and I want you guys to keep asking me questions and sending me messages. And whenever because I know that this live was supposed to happen at 7. So when I created the live, I must have created it like there's two types of lives. There's the live and then there's a live stream. So this is my second live. So I'm learning as I go, and I must have created it on the stream, and it was asking me to upload this program and stuff. I was like, oh my God, I'm going to have to change it to 7:30 because I don't know what this is. So then I recreated the link and I did it the correct way, which is why I was able to see you guys. Great analogy. Kim, you know that's my forte. Kim and I have known each other since, let me think, 2009, I believe. And we still work together. Okay. She's like my, when you have a cheerleader all the time, she's like my cheerleader. Every time she sees me, she's my cheerleader. So, so that's the difference between the PhD and the DNP. Some people might ask, do you want to keep going? No, I don't. I think I'm done with with education for right now. There's so many things that you can do now. Like once you have certain credentials, like your master's or your doctorate. Oh, this is the analogy I was going to use. So in terms of how doors open for you. Okay. So when you have the associate's degree in nursing, you're limited, right? Because we talked about the fact that a lot of hospitals want minimum of BSN prepared. So we kind of, beat that to death already. Now, when you get your BSN, the door opens a little wider, right? So now you can do a little, you're at the bedside, you have that requirement that magnet loves, because a lot of, these hospitals have the one magnet and the one BSN prepared. So you have that. So great. You fulfill their minimum requirement, right? So that got you in the door, because remember, a lot of hospitals want a minimum of BSN. So that opened the door for you to work at the bedside, right? Let me lower this camera. I feel like my neck is hurting. When you get a master's, that door that went ajar when you got into the hospital opened a little wider. Okay. Now it's like, okay, so it's about, let's say at a 45-degree angle. And now I can do a little bit more. Now I can educate. I can teach students. And that's for your MSN in nursing education and leadership, right? If you go to the NP, now I can treat patients. I can prescribe. I can independently practice. So your door it's wider. You can do more things. So you're not only stuck at the bedside anymore. You're more in a private practice. You're in a college. You're teaching clinical. You're at adjunct faculty member, doctoral degree, all doors open. There's no door left unopened. Okay. So what does that mean? That your opportunities are endless. Okay. So that is why it depends on what your goals are that you should continue side and have no and not everybody's a good teacher anyway, right? Some of the teachers I had during my nursing school sucked. So not everybody likes to teach. Okay, everybody wants to teach, but not everybody knows how to teach. Okay, because there's a difference. Okay, if your students don't understand what you're talking about, you don't know how to teach. So if you want to teach, then yes, go for your master's. If you don't and you just want to be at the bedside and just, regular, you want to do your 312s and be gone and go home and take your days off and come back, then you can stay like that. Okay, and that's fine. There's nothing wrong with that. Kim Ecker said that would be me. No, it wouldn't. No, it wouldn't. Kim is good. I don't know. Maybe good. No, you have to know Kim. Kim's different. Kim's a little different. She's special a little bit. Jessica says, do you have tips on how to deal with mean instructors? Well, it depends. I think all instructors can be a little difficult at some point. I'll give you an example. I can be a little difficult sometimes. I'm not mean though. My students usually they usually love me. And I'm not just, bragging, but I think I'm an awesome clinical instructor. But sometimes communication helps. I know that a lot of students are afraid of voicing their opinions to their instructors because they think they're going to fail them, right? That's the common thought process. Oh, if I tell my clinical instructor that, there's something that they did that I didn't like, she's probably going to fail me or he's probably going to fail me. That's not the case. Okay. So now if you wait until it's like midterm time and you express something that maybe could have been handled week 2. Okay. So usually if you have like a 10-week program and around week 4 or 5 is your midterm time and there was something that you didn't understand and your instructor probably didn't talk to you the right way and told you in a mean way, that's probably why you feel that, they're like that, and changes didn't happen, then you cannot blame the fact that maybe she didn't pass you during the midterm eval for that. But it's always good to communicate. I have had difficult students myself, and that's how I kind of learned my way through when I'm teaching, because I started teaching in 2016 after I got my master's. So I was pretty new at it. And, in every clinical group, you have the one student that challenges the instructor, that, is a know-it-all. Like I always say that there's one of each. So there's the one that you're midway asking a question and they already kind of finish the sentence and try to answer. And then well, guess what? The answer is totally wrong. And then they try to argue with you because they feel that they know more than you. What I did one day for these types of students is that I actually let the student teach. So the student was interrupting me so much that I just let them teach the class, like the clinical day themselves, and then we had to repeat that clinical day. So after that, the student didn't talk again, because you will have that, but you also have to communicate with the instructor when you feel something is not right, when you feel that you're not being treated fairly. It's okay to talk to them. If changes don't happen, you have to follow the chain of command. So you have the clinical instructor, right? You talk to them, like, let's say I was the mean one. Let's say I was the mean one. You talk to me. If I don't change how I approach things, how I approach you, how I approach other students, because it has to be a respectful environment, then there is a clinical leader. Okay, so there's someone, which is usually the theory class instructor, your professor, who's in charge of that clinical. So you have to follow the chain of command. Don't jump the chain of command. Follow it. Talk to the instructor first, and they will actually appreciate that you took them aside and gave them this feedback, because it could be that they never taught before, or they might be going through something that's taking forever to resolve. You never know what everybody's struggling with. Just like you as a student may be struggling with things, instructor struggles with things all the time, especially when they're dealing with a group of 6, 8, 10 students at one time. Jessica says, I'm scared of my upcoming semester, clinical instructor yelling and tearing up your work. Is this something that your clinical instructor doesn't like they tear up your work during clinical? If that's the case, then you need to take it then above her and go to the clinical leader. I mean, that's pretty embarrassing if you have a clinical instructor that's tearing up your work. We want student nurses to graduate, take their NCLEX, and become our coworkers. We want that. So we don't want you to have the impression of nursing that, like, how they say nurses eat their young. That's being phased out because there's such a bigger, younger generation getting into the nursing field, that a lot of the older nurses that usually would do that are retiring. Not that you won't find some new ones that think that because they have a year in that they're going to eat you and stuff. No, you will probably find some of those, and you just have to be professional and communicate your concerns. And if they are not fixed, then you go to the next person, which would be your manager, your assistant manager, whoever is above that person, because you should not be having to go through that, especially during the time that you're doing clinicals where you're actually learning things in order for you to become a nurse acceptable. Super nurse, Nightingale, oh my God, what a pain. I know nursing students go through a lot of stuff, especially, if they're going in at 6:15 a.m. and they have to stay there. If the clinical is 6, 8, I've done 12-hour clinicals. So it can be a super long day. And it can be a stressful day. I've had clinical days where I'm in a contact precaution room for 2 hours, because how I do my clinical is that if there's a patient that has a trach, wounds, whatever it is, I bring all of the students in with me, because I don't know when they'll be able to see a trach again, or a peg tube, or like a stage 4 wound. So we were in this contact precaution room for literally 2 hours. And the staff already knew that we were in there, because obviously the students had other patients to tend to, but they really wanted us to do this patient. The patient was obese, so it was a lot of care. And we were all gowned up. We had masks and goggles, our gloves and everything, because it was a contact room and we were going to do suction and all that. So they got to learn a lot. So I kind of make it like nursing huddles, like nursing student huddles. And I also do that when we're passing medications, so that everybody can learn classification and everything. And as the weeks go by, the huddles for the med pass will kind of go away and be more one-on-one. So it just depends on the teaching style of the clinical instructor. Okay. But if after talking to that clinical instructor, things don't change and you just don't mix, it's okay to go to the theory person, the theory faculty who's in charge, and say if you can be changed to a different clinical. They have done that. I mean, and sometimes they may even change the instructor. There was one time as well that other instructors had to take students from other groups because they've let go of certain instructors that were just super mean to the students. The students weren't learning anything from the instructors. So it can happen both ways. Let me see if I missed any questions up here. From all of you that are online still, do you have any other questions? Is there anything that you need more clarification on? Oh, let me see. One more thing. So for LPNs, because this was a question that I just saw that I had here. Thank you, Kim. Kim says, are you comfortable in your role? You are very good. Thank you, Kimmy. I am comfortable in my role as a nurse educator, but I never leave the hospital setting. I always tell my students, if you're going to do other things, and you are able to keep a bedside position, do so, because that is how you're going to keep your skills up, okay? But you also have to like to teach in order for you to become a nurse educator or a clinical adjunct faculty. And I always ask my students, like yesterday I did evaluations on one of my virtual clinical groups, and I always ask at the end, what is there anything that I could have done better or that I could have taught you more of? And I do take a lot, many don't say much, and that's great, but I do want feedback because that's how you're going to change your style of teaching. So you have to like to, there are days that I'm super exhausted, especially those semesters that I teach multiple times a week. And in the beginning of this year, I was on like literally almost every day. So my brain was super exhausted. Yeah, I know, right? The good teachers ask for feedback. You need the feedback because that's how it's going to check this in case there's something that you did wrong. So I was super, super, super tired because when you're teaching, it's different than when you're working in the floor. When you're working on the floor, taking care of patients, you're on your list, taking care of that, prioritizing this, a code here, a trach here, a wound here, right? You're kind of like on the go all day. And yes, you're obviously using your brain because you have to. But when you are teaching clinical, you're not only running around like a crazy nut, but you're also using your brain constantly with 8 different students that have 8 different types of situations, each have probably 2 or 3 patients at one time. And your brain is like working constantly. So there was a point, I believe back in February, that I had a super exhausting day. My brain was just like fried. I couldn't even remember the password to my phone. Okay. And who forgets that? Like you're checking your phone, you're on your phone more than once a day. So I couldn't remember for the life of me. It took 2 days for me to remember. And by then I had reset the phone. I had to take like a whole day of just not doing anything. I went, did my hair, did my nails, did my feet. I try to do things for myself and not think of anything work related. And it wasn't until 2 days later, like around noon, that my brain sort of like opened up like a light and I was able to remember my password. But by then it was just too late. So you can get super overworked when you are teaching large amounts of groups for many days. But the students didn't realize that I was like that because I like to teach. But you do use your brain a lot. If you're a good educator, if you're a good clinical instructor, that is going to happen because you're constantly trying to teach the students. Like when I go into a unit, the nurses already know, okay, great, she's here. They tell me who needs to get the Foleys removed, who needs Foleys, who needs wound care, who needs this, who needs that. And I make a list. And by the end of that day, especially when there's like flu season and pneumonia season, I print out a list of all the IMs that we have, and we all do them. Okay, so I try to get them involved, which is why we're kind of like super exhausted by the end of the clinical day. let me see here. What I was going to say regarding the LPN. So you can, if you want to become an LPN, that's fine. If you don't want to be an RN, that's fine. LPNs usually are working in like a nursing home environment or an assisted living environment. And honestly, like they're super overworked. Like I feel so bad for LPNs at times because they're passing mental days. So it's like so limiting for them, but it's so much work for them, and then they're usually understaffed. So that's why a lot of people that are LPNs go and get their RNs, like, and there are bridge programs that you can do, and then you have to do the clinical hours because there is a difference between an LPN and an RN in terms of like evidence-based practice and research. All right, so I'm going to look through here to see if you guys have any other questions before I end this. I want you to tell, oh, somebody said something. Super Nurse Nightingale, home care, corrections, doctor's offices, and clinics. Yeah, so you'll see them in corrections. You'll see them in doctor's offices. Like when you go to the primary care, they'll take your vitals, your weight, and then they'll input that information in there. And then they'll do like immunization clinics. I see a lot of LPNs as well at the pediatrician's office when they're intaking information on the kids and if they have to get any type of immunizations. In home care, I'm not too familiar with the role in home care. I guess I'm assuming that it's more for regular home care as opposed to things like assessing wounds and stuff, because there's a difference. LPNs cannot do a nursing assessment. And that is important to know for those that are online that are studying for the boards or trying to understand the differences when you're talking about delegation. When it comes, the difference between an LPN and a RN is that the RN is the one that's in charge of the nursing assessment. So an LPN cannot do anything assessment related. So when it comes to home care, it's probably more just to see how the patient is doing at home. Do they have the proper materials at home that they need for their quality of life and activities of daily living? But it's not really because they're assessing the patient, because that would be an RN's role. That's great. 28. Did you so then you went for your RN, Super Nurse Nightingale, I assume? Okay, so let me see. Super Nurse Nightingale says that she was an LPN for 28 years. Mm-hmm. Okay, good. Do you currently work in the hospital system? Because you probably now know, like, there's in the hospital that I work for a long time ago, and Kim works as well. They had a lot of LPNs in the past, but how I said they phased them out, and they became like the unit clerk, like they were in charge of all that, the kind of like the management of the patients coming in, assigning the patients, doing more of the secretarial. But they still use LPNs, and some ERs they use them as like ER techs. Or they'll still, no, you still do home care. Okay. Did you see a difference between what you used to do as an LPN and what you do as an RN in home care? Because you said that you did home care for both. So do you see a difference in the things that you're doing? I'm sure your responsibilities increased. I'm going to check my phone, guys, real quick to see if there's any other questions. Okay. So, no, okay. She hasn't answered yet. Oh, somewhat. Okay. Home care, home care can be challenging. Like, I don't know if I would be a good home care person. Like, I know my limitations too. So I don't think I would do, I wouldn't even do hospice. Like, I couldn't do hospice. I couldn't do peds. Those things are super emotional to me. So I kind of stay in the adult environment. It's funny because I was doing a mental health clinical rotation, and in this facility they had a children's unit and an adults unit. I dropped the students off, like half of the clinical group, into the pediatric. I couldn't even see these kids because every time I saw the kid, I'm thinking about my kids. So it was too emotional. Super Nurse Nightingale says, I was allowed to do assessments, but had to get it co-signed. Okay. Probably because it's a home care environment, but in the hospital, whenever you're working with an LPN in the hospital, so the RN would have like the entire load. So let's say there's six, well, if you're working with an LPN, they'll increase it. So let's say you had 8 patients. The RN was in charge of, let's say, 4, and the LPN was in charge of 5, but the RN had to co-sign absolutely everything that the LPN did, with the exception that the LPN couldn't do assessments and IV pushes and, IV medications. But in the home care environment, okay, you do peds, it's a little bit different. So that's great. Okay. So let me see if there's any other questions. That's good to do peds. I couldn't do peds. I always I take all those stories with me and stuff home and can't stop thinking about them. Okay. What's your opinion? Oh God, Shema. So this is one of my previous students. She's one of my previous students. She's already a nurse. What's your opinion on master's versus doctorate degree? Well, Shema, you came in late because I already talked about that, but I'll review it again just for you. And she says, especially FNP, which is family nurse practitioner. So let me see. Yeah, Super Nurse Nightingale. I'll if you look on the YouTube channel in the About section, you'll see my email there. But let me write it here real quick before I answer Shema's official doctor RN@gmail. I'll write it here in the comment box for you. That's my email. Okay, so Shema wants to know about the differences. Where did you go? Let me see. What's your opinion on master's versus doctorate degree? So if you want to get a Shema, you know how I am about education. So I always have said, if you see it in your future that you want to teach, okay, remember, there's a difference. So as an NP, you can teach, but you don't have like that knowing how to do like your lessons, actually teach. You can teach with a master's. You have a master's as an NP, but you're very focused in the treatment of patients, right? Now, if you go to a master's program that's a master's in education, nursing education and leadership, it's kind of a little bit of a different feel. But you can teach with a master's. If you want to become an NP, you know that you definitely need to have a specialty in mind. In your case, you said family nurse practitioner. You can go for it. You know that I always say, Shema, you need to have a little bit of experience, and this is something I covered in the beginning of this, before you go ahead and start thinking about becoming a nurse practitioner, because nobody, it's hard for someone to say, okay, if I have a between this person, and this person has no experience, came straight out of school, and this one has experience, I'm going to go with the one that has experience, right? Now, how do you decide if you want to have a doctorate? It depends on the goals you have. Okay. I use the analogy of a door. Like when you have a BSN, your door into working in a hospital opens in many of them, because a lot of them, their minimum requirement is a BSN. When you get your master's, the door opens wider because now you can teach, now you can practice if you went the NP route, but if you went the education route, you can teach, you can become an adjunct faculty, you can work for schools as well as keep your bedside. Remember, you're adding on things. Now, when you get your doctorate degree, all the doors open and you're limitless. Like you could do whatever you want in nursing. You can go into administration, you can go into education, you can write, you can write books even with a BSN, but I'm talking about like journal writing. The doctorate credential has a lot of weight. Okay. Master's does too, but when you get a doctorate degree, it has a lot of weight. So how are you going to use this weight? Okay. I chose to use it by opening up and trying to be, in this internet forum and in the YouTube world, and trying to bring my knowledge and experience to teach others. And Shema, I like to teach. I want to hear what Shema has to say about my teaching style. She was in my clinical group, I believe, twice. And I decided that if I'm going to teach college level students, that I needed to have the experience and the weight of credential. Okay. And I said, okay, my master's was fine. That's fine. But a doctorate degree would be even better. So that really said to me when I was done, you know what, let me open this YouTube channel. Let me see how it goes. It's been growing, it's growing great. And I'm thankful for all of you that are following me and supporting me and have subscribed and see my videos. Always give me suggestions as to future content because I'm always, Shema says, best legit professor ever. I like Shema. Not because she said that. She was an excellent student. But always give me suggestions. I'm always writing things down. Like I'm thinking of doing one S-bar. So because somebody gave me a suggestion about doing one of those, because it's so important to know that when you're communicating with other nurses during report, as well as when you have an emergency or you're contacting a physician. So I'm going to do that. So that's the main reason why I wanted to open the channel, because I got that. I don't even, like, when I got my master's, I wasn't even thinking about opening a YouTube channel. I didn't even, I mean, that was not even part of my thought process. But once I got that doctorate, I said, you know what else can I do to provide this knowledge and education that I have and experience? And that's why I opened it. So I want you to be very careful who you are getting your education from, who you're getting your information. That's my dog. He thinks he's the alarm of the house. So he hears a noise and he's barking. Who you're getting your education from, because it is super important that is a legit source, okay? Because I know there's a lot of people out there. Shema says, to be a clinical professor, you need a master's. Yes, so for you, depending on the state. So in Pennsylvania, they say that you need to be enrolled in a master's level program in order to teach BSN prepared students. However, the universities can ask for whatever they want. For example, one of the universities in Pennsylvania says, I don't care that they say that you have to be MSN enrolled. We want master prepared nurses teaching our bachelor's students. In New Jersey and many other states, you are required to have a master's at a minimum to teach bachelor prepared students, like people that are in a bachelor's program. Okay. If you are teaching an associate's program, they may require, obviously, for you to have the BSN, but even I've known certain associates program, and many of them will require you to have a master's in nursing for you to teach these students. But if you have a BSN and not a master's, you can teach CNA school, like tech school, LPNs. But every state is different. But I'm telling you that for most states, with the exception of the one I know is PA, they require you to have a master's at a minimum when you're teaching BSN students. Okay. And you kind of want that because you're there, you're in a BSN program. So you want to have, education from someone that kind of knows more than you, basically. So they can add on to what you know in addition to their expertise. Okay, let me see if there's any other questions. All right, so I don't see any other questions. But again, thank you guys for joining me in this Q&A. I'm going to try to have one every week. Email me. I put my email here in the comments. It's officialdoctorrn@gmail.com. This channel. Subscribe, share with everyone, like the videos, watch the videos. I just put a video on neural. It took me an eternity to do because I'm surprised it was only 38 minutes. It should have been like hours. But I think it's an excellent review. I felt that it helped me a lot because neuro is not everybody's forte, and it surely wasn't mine. So doing that video really actually made me remember some things, and I learned some things too, because just because I have a doctorate, guys, doesn't mean I know everything. Okay, people, there's something flying. So people say, oh my God, you must know a lot of, no, you learn things every day. And when I did that neuro video, I kind of realized how many things I didn't know. So that's another reason why I wanted to open this channel, because it's just, and my husband tells me that all the time. He says, it's good that you're doing this because you can kind of refresh your memory, review, and keep yourself current and make sure that you're understanding things so that when you're explaining it, it's easier for people to understand. So thank you for joining during this Q&A. Shema says, thanks, Dr. Ryan. You're welcome. Thank you for this. You're welcome, Jessica. Kim, thank you very much for your time. It's so appreciated. No problem. Look out for the next Q&A. I'll try to have one next week. Send me your questions. Write down in the comments whenever you see it. That way I can kind of research ahead of time, especially if you have some other questions that I might need to give you a more in-depth response. All right. Well, thank you for joining me this evening. Have a good rest of your day. Bye.